Hi everyone, my name is Stephanie Flores, and in this presentation, I'll be discussing a health policy analysis focused on type 2 diabetes mellitus in Mexico. This analysis is based on the research article Diabetes in Mexico Cost and Management of Diabetes and Its Complications and Challenges for Health Policy by Barquera and colleagues, published in 2013. This analysis focuses on type 2 diabetes, one of the most pressing public health concerns in Mexico. Not only is diabetes highly prevalent, but it's also the leading cause of death in the country. The rise in obesity, poor diet, and poor lifestyles has contributed to this epidemic. The main health policy examined is Seguro Popular, a public insurance program launched to cover Mexico's uninsured population. It also reviews national strategies under the National Health Plan from 2007 to 2012 and efforts like the Unamis Chronicas Clínicas, which is a clinic that focuses on managing chronic diseases like diabetes. These initiatives aim to improve access, prevention, and quality of care. The study used quantitative methods. Researchers relied on hospital data and national cost estimation, along with a national health survey like the ENSANUT, which is Encuesta Nacional de Salud y Nutrición. This stands for Nutrition Results of the Mexican National Health and Nutrition Survey. Um, this allowed them to track prevalence, mortality, treatment patterns, and healthcare cost over time. The analytical techniques include descriptive statistics to show trends in diabetes rates and mortality, and predictive modeling to estimate the future burden of complications like heart disease, kidney failure, and amputations. Cost modeling was used to break down both direct and indirect healthcare expenses. What were the main findings? Diabetes prevalence more than doubled from 1994 to 2006, reaching 14.4% of adults. It became the number one cause of death, responsible for nearly 14% of deaths in 2009. Despite policy efforts, treatment quality remained poor. Only 6.6% of diagnosed patients had their diabetes under control. Costs were also staggering, over 1.1 billion in direct costs and 177 million in indirect costs like disability. The authors made several recommendations, like creating a national diabetes registry, improving provider training in chronic disease care, expanding access to medication, especially insulin, promoting public education and healthy behaviors, strengthening data systems and care coordination, and adapting environmental policies like food labeling and marketing restrictions. What is my professional opinion? This analysis did a great job capturing the impact of diabetes on Mexico's healthcare system. The data was very thorough, especially regarding economic burden and epidemiological trends. It's clear that these authors put a lot of work into the research for national statistics, economic estimates, and policy actions into one place. I did feel like this article could have gone a little bit deeper into how well the policies are actually working. It talks about what's been done, but doesn't really evaluate those efforts that have made a big difference yet. Overall, it's a strong report on the cost and policy action, but it just left me wondering how much progress has really been made for those individuals who have diabetes. Going forward, I believe Mexico will need a stronger investment in prevention. I hope that this analysis gave you a better understanding of the challenges that surround diabetes policy in Mexico. Thank you for watching my presentation.